Hi, this is Dr. Mario Mancini, the Medical Director of the Center for Integrative Care, Functional Medicine and Peak Performance Center here in San Diego. I want to take a moment and share with you some information about a technology we use at our center that has a unique ability to accelerate recovery at a significantly faster rate than any other medical modality that I've seen over the past 20 years. Because this is an aggressive therapy, we use it primarily for athletes who need to get back in their training or competition in a fraction of the time, or for anyone looking for an alternative to surgery or medication. This technology is called ARPwave Therapy, and it's based on a simple yet often overlooked fact of all injuries, and that is, wherever there's an injury, there's reduced blood flow. This therapy utilizes an external device that searches for the source of the injury, driving high amounts of blood flow into that injured area. Now, once the source of the injury is found, we have identified the origin of the problem where there's reduced blood supply. Now, here's one of the most unique components of this therapy. In locating the origin of the problem, we have found that it is not where the pain shows up. In other words, where the patient is experiencing the symptoms. Let me explain. Most people may not know that your muscles are like shock absorbers. They're meant to absorb force. So when you have a cumulative or sudden injury leading to muscle guarding, spasms or inflammation, adhesions, scar tissue, it's no longer able to absorb the force that it was meant to. The force is then transferred and redirected to a joint. Now, this could be an ankle, knee, hip, back, neck, shoulder, elbow, wrist joint, any joint. Now, joints, they were never meant to take on a high amount of force or impact because the muscles around the joint have a majority of that responsibility. So when a joint takes on more than it can handle, it becomes inflamed, swollen, and painful over time. The bones, the cartilage, and other structures begin to break down. And this is where I often hear patients come into our center telling us that their doctor said, the problem is that they have bone on bone. Remember, that is only where the problem ended up. The source of the problem is somewhere in the muscle structure where this therapy places its primary focus. So by locating the origin of the problem and driving high amounts of blood flow into that area, we are repairing and turning on that muscle so that it can once again absorb force. When that happens, it transfers and redirects that force that was ending up in the joint, returning it back into the muscle where it was meant to go. End product, pain reduces, joint function improves, and strength improves. Not because we turned off the pain signal, but because we redistributed the absorption of that force and impact back into the muscle structure where it belongs. ARPwave Therapy treats and repairs the source and origin of where the pain is coming from, not where it ended up. So a question you may want to ask yourself, especially if you've been experiencing chronic pain and you've tried everything, is this: do I want to continue to treat the symptoms or find the source and begin to treat the cause of my problem? I'd like to extend an opportunity for you to find out if we can help you with your condition. We're extending a risk-free ARPwave session to determine if you respond to this therapy. Call now to see if you qualify.